Delivering social care services for adults who need extra support is largely the responsibility of individual local councils. In 2021, the Scottish Government vowed to shake up the sector by creating a national care service aimed at ensuring consistent standards across the nation. It was billed as the biggest public sector reform of the devolution era, but in the years since, the plan has been repeatedly delayed and lost the backing of key stakeholders. At their conference on Saturday, the Scottish Greens withdrew their support for the legislation, which is currently before Holyrood. The party's leader, Patrick Harvie, joined us in the studio. Patrick Harvie, why are you withdrawing support from this?
The National Care Service was a policy that the Greens, along with a number of other parties, supported in the last election, and I think it's really, really important to acknowledge that a lot of people who genuinely need the long-term structural reform in the care service that was proposed and that was hoped for from this bill will be very, very disappointed. So I want to acknowledge that. But the fact is that the bill as it stands has lost support of the kind of people who are critical to its involvement, to its implementation. If a national care service is going to work, I don't think we can afford to go into that by simply abandoning the support of the people who represent the workforce or indeed the local authorities. And you know, this doesn't mean that nothing in that bill will go forward. What we've passed is a motion saying we want to work with the government if we can to get a stripped down version of the bill that retains the really important stuff that can be saved and that does still have cross-party support and can be implemented. But
you were in government, you backed this bill, this very bill in government. Are you just saying that because some other people have withdrawn support, well, so are you?
I think it was really important to do our best to try and make this workable. But in recent months, we have seen not just local government en masse, but also the trade unions that are going to be critical to delivering this. These are the bodies that represent the incredibly hard-working, dedicated professionals whose involvement, participation and buy-in is going to be critical to making any reform
But
work.
What's your problem with the bill?
I mean, there is a range of views amongst some of the different party members. From some, it's about the issues around local accountability. We always said that we wanted a national care service, but it has to be one that responds to local needs and local accountability, and some of that has been taken away by the current bill. For others, and a great many people in the party, and I think across the country, recognise that having social care delivered on a for-profit model, including some companies that stash their profits in tax havens.
Yeah, but this bill was never going to stop that.
This bill, it doesn't offer a solution to that.
But you backed it knowing that.
And I think it was really important that we gave every effort that we could to try and make it workable, to try and make it a package of reform that will at least get us started toward a national care service that's worthy of the name. But I think it's clear now that this bill isn't going to be able to offer that. So let's focus on what can be retained from it.
So can it be salvaged?
I think there are certainly measures in there. For example, additional support for unpaid carers, one of the most undervalued and under-recognised groups of people in the care service, or the care sector, if you like.
It's not completely dead then?
I think there are some elements of that bill that can be salvaged and can still make a really important difference, both to people delivering care and people receiving it. And I really, really hope that every political party takes from this the opportunity to come forward with better solutions for next time. The UK Labour government, the new UK government, is also talking about a national care service. The need for structural reform is still there, has still been articulated very, very clearly, most particularly by the people who depend on care services, and that must not be forgotten.
Patrick Harvie, thanks for joining us in Scotland tonight. The Scottish Government's Social Care Minister Maree Todd expressed regret over the Green Party's decision, but told us there's still space for dialogue and agreement around the provisions in the legislation to address the concerns of those who believe social care and community health needs to change. We reflected on the situation with the Deputy Chief Executive of Scottish Care, Karen Hedge, and the health and social care journalist, Penny Taylor. Is there a need for a national care service, Penny?
There is definitely need for a care service for Scotland. What form it might take is obviously being kicked around right now, but without a doubt, if we don't sort out the way our social care system works in Scotland, our NHS hasn't got a hope of recovering from COVID.
But do we need a national care service?
Yes, I think we do, because at the moment people work differently in different parts of the country. You know, if you're a disabled person, you might be able to get one benefit in one part of the country or another service in another that you can't get elsewhere. We used to call that postcode delivery. There's no difference.
Karen, do you think we need a national care service in Scotland?
So we definitely need a reform of social care of some sort or another. It doesn't necessarily need legislation to make it happen. We can still come together on a national basis to make change, the real change that we need for the people of Scotland.
Well, if it doesn't need legislation, why isn't it happening already? Why have we not got that?
That's a fantastic question. So pre-pandemic, you know, we were working with Scottish Government on the reform of social care, and obviously the pandemic hit social care and the health service really dramatically. Coming out of that, though, all we have seen is a real lack of collaboration across health and social care and the whole system, kind of spiralling into this arguing between politicians, between COSLA, between government, that has really left people out of it and left them behind.
There seemed to be a consensus almost after COVID that we did need something like a national care service, but that just seems to have gone.
I mean, it was COVID, what happened to disabled people who bore the greatest burden in COVID, without a doubt, you know, or people that need care. And that then led to Derek Feely, a former chief executive of the NHS in Scotland, being commissioned to write an independent review of what we should do. And Derek Feely involved and consulted deeply with the people who receive services to build his report, which was then adopted and is now apparently falling apart.
So is there any prospect of it now then, do you think?
Yeah, I think there has to be, because the rest of our kind of care service depends on it. The NHS, as I say, without an effective social care system.
There has to be a national care service?
Well, we can talk about that at greater depth, but if you want equality and parity, I mean, for instance, who's deciding on the qualifications that are required for care workers? At the moment, there isn't a national perspective on that. Standards, regulation, there isn't a national system for that, and that was one of the reasons why Derek Feely said, and this was based on what people who receive services told him, that they wanted a national service to offer equality and fairness.
So while we're talking about the social care workforce, so the social care workforce in Scotland are professionally registered and regulated by the SSSC. They do have to undertake qualifications and training to do that job. And of course, one of the key objectives of the National Care Service was fair work. But again, we don't need legislation to make this happen. In fact, if anything, the legislative process has slowed down the adoption of fair work principles within Scotland.
But I mean, you know, the care sector, care homes, are run privately for profit. They're not going to pay that unless they have to.
So if you look at statistics, actually the amount of money that care homes have made in the last couple of years has been less than what a bank would consider the sector to make to be financially viable. What they are paid by the government to deliver services is the equivalent to £5 an hour per resident of a care home. Now, a good few years ago, my kids went to after school club in the local church hall, and that was £12.50 an hour then. You compare that sort of experience to the type of real specialist care and support that people living in care homes get, often at end of life with advanced neurological conditions. It's just simply not enough.
Penny.
But social care is about so much more than care homes. You know, the whole third sector, the charity sector that is dedicated to meeting people's needs in their own homes. I mean, those are charities. This is not for profit. One of the problems, I think, and this is why one of the schisms has come, is that local authorities allegedly they pay their staff more than they will then disburse to the third sector to provide this care in people's homes. That's not fair.
So are you saying councils are blocking the system then?
Oh, well, I think COSLA, the Convention of Scottish Local Authorities, has withdrawn its support from the National Care Service because it doesn't want to lose the ability to run its own adult social care.
Are you blaming them for making the system as it stands at the moment fail?
Well, this is what the people who use Services have told Derek Feely this is why the Feely report made its recommendations about having a national body that would run social care or oversee social care nationally to set standards and set pay and ensure equality and take it away from vested interests that, frankly, the employers are.
Vested interests like you, Karen, is what she's talking about there.
Well, I must also say that many of our members at Scottish Care are also care-at-home providers, and you know, they do go into people's houses delivering that care and support.
But
and
even
they
that,
have
the whole system just seems blocked. It's blocking right back to ambulances at the hospital door.
Yeah, so they have exactly the same problem. It's been reduced, social care has been reduced to 15-minute visits in people's homes, and it's simply not right. It's turning into a time and task, function, process, and actually it's forgetting that it's about people and the time that we spend with them, enabling them to be independent and stay in their homes for longer.
Talking about the time we spend with them, that's our time up tonight. But thanks both for joining us in Scotland tonight.
That's great.